I'm going to talk today about how to fix an anterior pelvic tilt. So just very quickly, an anterior pelvic tilt is where your pelvis wants to sit forward or anterior. This will cause your back to arch too much, your stomach to kind of spill out, and will cause a lot of compression and irritation, not just to your low back, but also to your hip joints. The reason this happens is because certain muscles in our body get tight and pull the pelvis forward into that anterior tilt. The muscles that are typically responsible for that are the hip flexor muscles, which would be your psoas and your iliacus muscle right inside your pelvis. And then also your low back muscles, when those are tight, that can pull the pelvis into an anterior rotation. You can imagine if it's pulling this way, it would cause the pelvis to pull forward. And then in addition, your quadratus muscle, which isn't shown here, but it's this big muscle here in the front of your thigh. This muscle in particular, when it's tight, will also pull the pelvis forward. So the important thing to know about this is that these muscles can all be tight and create an anterior tilt, but the primary muscle that's responsible for that is this hip flexor muscle. Once the iliacus and psoas becomes tight, it pulls the pelvis forward, and then the quadricep joins the party, and the low back muscles join the party. So it's really important to make sure that you address those hip flexor muscles. Now, you may be wondering, well, how do I do that, right? So these muscles are pretty deep inside your abdomen. You know, if you look at your pelvic bone and you put your hands on your hips and you find that bone that sticks out right here at the front, like here's your hip bone on the side, you bring your fingers down, put your fingers right here. Right inside that is where that iliacus muscle lives and that psoas muscle lives. So that is the spot that you're going to want to get to, and you need to use a tool that can reach that. Now we have tools like balls, bigger balls, is like a softball sized ball. This one's not as hard as a softball, which is a little bit better. And you can imagine if you try to work on this muscle with this ball, it's not going to really reach. You have all that tissue to get through. But you're going to need something a little bit deeper to even get at the psoas. So this is a perfect solution for the psoas. And then the hip hook is a great tool to be able to get into the psoas and the iliacus, because I'm throwing it all over the place. The ball will only get at the psoas. The hip hook is what you need to get at the iliacus. So my suggestion would be to first use this size ball to release the front of the hip to get at the psoas. So you just lean over onto it like this, and I have some videos that show exactly how to do that. Then work on the iliacus with the hip hook by leaning into that and using the lever to rotate the tip out to get to the iliacus. And then you can work on those accessory muscles. Remember, those are the symptom and not the cause. So working on the quad is important, but not necessarily as important as working on the psoas and the iliacus. You can use a foam roller where you just roll on your quad. Remember, that's this muscle on the front. And you can roll till you find a good spot where it feels really tight, and you hold that spot. And all of these things is really important to find the spot that's tight and to hold it where it's tight to allow the muscle to release. Because if you rub it or if you stretch it, it won't change that pattern of holding, which is what's pulling your pelvis forward. One more thing that I want to mention that's really important is that sometimes people will have an anterior tilt on one side more than the other. This we call an anterior rotation. And that's what creates an imbalance and a twist in your core, which can affect the alignment of your entire body. So it's important to make sure that you are symmetrical and that you are addressing both sides of your body when you're trying to release and support an anterior tilt.